how do you find each other? So there's the founder entrepreneur that needs the medical adult in the room to either guide a safe innovation or how to navigate a health system or the industry. And then there's physician entrepreneurs, or maybe not, maybe they're not founding their own separate company, but they want to be participating, let's say at the CMO level with the startup. How do you go about finding each other? How does a CMO find a startup, and how does a startup find a CMO?
Yeah, that I'll tell you first off, that's really challenging because, being in that space is interesting. And sometimes you have to get lucky, or, like me connecting with Omniscia Health was basically, this was a lot of the founders that were there were the same founders that I worked with on KP Baby, that chatbot virtual assistant that I was doing at Kaiser. So I kind of like already vet. It's like, okay, I worked with these guys for 5 years. So it seemed like a natural progression after I left, but that's kind of getting lucky, right? It's challenging. I think there's a lot of work that has to happen for the person that really wants to be a chief medical officer or to be involved. Maybe you're a product officer or some other, whatever the title is, you really have to decide for yourself that that's what you want to do, and then figure out how to put yourself out there. And physicians have no training in branding themselves or marketing themselves. So it's like you just sit there and you're like, why won't someone hire me for, you have to be out there in the space. And again, alluding to Arlen Myers, he's like, what did he say? Some paraphrasing him. He's like, oh, if you want to do this and you don't like LinkedIn, you are, he would he'd basically like, oh, you're a moron. I mean, I'm just paraphrasing. Right. He's just brash in the way he says things. It's like, what are you thinking? You have to get yourself out there. So I think a lot of that goes on the CM. You have to look for people, right, in some marketplace. And marketplaces can be like LinkedIn. You can start to, if you're a physician, you can write, you can be a researcher, you start to publish stuff, figure out some way to get out your ideas out there. And by the way, as an entrepreneur, it's very hard because I was doing things that were like intellectual property of KP. So I did like 10 years of work on multiple products and I couldn't externally
talk about it.
So it's like a downside of being an entrepreneur, right? So I'm having to tell stories and go on podcasts on Persimmon Health, right? So that's, but you have to wait to tell your story of the things that you believe, the things you're interested in, the work you've done, and figure out how to tell that story. It can be publications, writing a book, or whatever. But you have to the physician has to put themselves in a place where they can be known. And the physicians can, do that. They can join accelerators that are looking for physician mentors. They can join incubators. They can basically start talking to venture capitalists that they know. And because venture capitalists and angel investors they're investing in companies, and now they're like, well, I want this digital healthcare company or this med tech company to succeed. And maybe they need someone to help validate their work. So they'll be looking for doctors that have the expertise or the desire. So it's basically comes down to networking, right? And so the physician has to do part of the role. They have to put themselves in a place where
that's
they're
great advice.
known,
and I know so many
saying,
startups that we work with are looking
a commodity
for
that can help, and this is what I love doing, right? And then on the other side, once you have the physician or the CMO, whoever, or a nurse, whoever doing their piece of the pie, then the founder, the entrepreneur can do their piece, right? Which is then to work with accelerators that are in the digital health space, or do all the same things, or search out people that seem to be talking about some of the things they like to do, or writing books, or really getting their message out there. Then you can connect. So it's a two-way street, right? It's like the entrepreneur, the co-founder can't do anything if there's no one out there, because otherwise you're just getting lucky. You're like, well, let me talk to my friend, a friend of a friend of a friend. And those things work, and that's how it started. But if you really want to be systematic about it, as they're talking to like a process systems guy, it's like make yourself visible, and on both ends, make yourself visible about what you're doing, what you believe in, and go to these different sources. And it's like you can find marketplaces to put yourself together, but it's not well advertised. You have to kind of discover it. And I'd say, like, example, like Innovator MD, which is like one of the groups that got me started. They have started kind of a marketplace where people can put their names out there saying, hey, I'm looking for this type of role. And so that's really early and nascent in that process. But that's like another avenue that exists, and there'll be more as digital health grows, because it has to grow, and it has to grow with some clinical expertise in it to really succeed and really do things the right way. And it's more of a marriage. It's like technologists and entrepreneurs can bring great ideas. They have to work with physicians or clinical folks that are open-minded and want to do it differently, right? And together, when you put them together, you're really going to get products, and you're going to really have chances to scale and develop things